I'm making this video this morning and I hope that it will be short and will require little or no editing before I can post them on the platforms that I use. And of course, the topic this morning is the link between autism and acetaminophen, Tylenol or paracetamol, of course, depending on where you're watching from. It's really important to know that many medical organizations are still recommending acetaminophen to be the safest form of pain relief, especially for pregnant women, lactating mothers, and for children. And the reason for that is that untreated pain or fever can pose significant risks to the unborn child as well as to the pregnant mother. And so where's the confusion? The concern comes from some observational studies in the past that have shown a small association between autism and Tylenol. And this was in patients who were taking Tylenol frequently and over a prolonged period of time. Now, I mentioned association. There's a difference between association and causation. Association is almost like two events that are happening at the same time, whereas causation is a direct cause. It's almost like during the winter, people tend to eat more soups. It doesn't mean to say that the winter is causing people to eat more soups. It's just that those two happen at the same time. And causation is, an example is if you eat a badly preserved food and you end up with food poisoning, then that's direct because the consumption of the badly preserved food is causing the food poisoning. So that's the difference between those two. As a matter of fact, there was a major study last year that took place in Sweden, and it involved millions of children. And the great thing about this particular study was that it looked at siblings, which hadn't happened in the past. And this study found that there was no link between autism and Tylenol because the parents of the siblings were controlled for the genetic influence as well as environments. The siblings all had autism and the parents were exposed to Tylenol for one sibling, for instance, and for the other sibling, there was no exposure to Tylenol, but still the siblings had autism. So this particular study is considered to be one of the strongest form of evidence to suggest that there was no link between autism and Tylenol. And of course, as healthcare professionals, we know that autism is complex. There are other risk factors to autism. One of them is family history of autism. Also, if the parents of the child were older parents at the time of pregnancy, exposure to drugs that we know to increase the chances of developing autism, for instance, valproic acid or sodium valproate, again, depending on where you're watching from, and sometimes premature birth can increase the risk of autism. So what should you do? As usual, if you're pregnant or you're a breastfeeding mother, always consult your pharmacist if it's an over-the-counter medication, consult your primary care physician, your OBGYN if you're pregnant, or your pediatrician before you buy any medication for your own use or you take any medication that had previously been prescribed. Your medically qualified provider is the best person to consult if you're unsure about what medication you should take at any one time. Please do not tough it out. There's a reason why you're needing Tylenol or paracetamol or acetaminophen. There's a reason why your child needs pain relief. In many cases, there's an infection that's going on that's causing the fever, that's causing you to want to take Tylenol, and that needs to be taken care of. If you have fever in pregnancy, it has consequences. You could end up going into premature labor. If a child is in need of pain medication or Tylenol to reduce fever and they don't receive it, the child could have a seizure, which has consequences. Again, in pregnancy, lactation, children, anyone, take the smallest effective dose of any medication and you take it over the shortest period of time. I hope this clears any confusion that you might have regarding taking Tylenol while you're pregnant. And if you have any questions, please ask in the comment section and I'll be happy to answer you. Till the next time, have a wonderful day. Goodbye.